Welcome to the Cardinal News of Virginia, a podcast from Cardinal News. We are a nonprofit news outlet covering Southwest and Southside Virginia at cardinalnews.org. I'm Dutchie Jessee, and the Cardinal podcast is sponsored by 5 Points Creative, a full-service, award-winning marketing firm serving clients all over the U.S. from their headquarters in Roanoke, Virginia. I'm Dutchie Jessee, as I said, and I've got Emily Schabacker with us. She is Cardinal News' healthcare reporter. Hi, Emily.
Hi, Dutchie. How are you this morning?
I'm great, and it's wonderful to have you sitting with us for today's episode, which is going to focus on Carilion Clinic's efforts to start a kidney transplant program in Roanoke. So let's get started by just talking about the timeline for this. When did Carilion first propose that they should have a kidney transplant program in Roanoke?
Yeah, so Carilion announced their plans to start this program in January of 2024. So their original plan was to have it up and running and have patients coming in by October 2024. But that has obviously been set back quite a bit by some opposition from University of Virginia in Charlottesville. And the Certificate of Public Need Division, which is the state division that health systems have to apply to if they want to bring in a new service, submitted like a recommendation for to deny the program.
So let me back up just a little bit and talk, just define what is a kidney transplant program. Is it a building that houses this service? What is involved with a program?
So with a kidney transplant program, they won't need to build any new structures. It's mostly just having the specialists and experts in place in the health system to be able to bring in patients who are in need of a kidney transplant. Now, they have to meet some standards by national regulatory boards. But those are, Carilion really has the infrastructure in place to be able to bring this program to Roanoke. They have a surgeon who, the last 10 years, he's really focused on bariatric surgery, but he did complete a fellowship in organ transplant during his training. And they're also bringing in another surgeon who has been working at the Salem VA, and he has been, active, more recently active in organ transplants. So,
where in Virginia are there current kidney transplant centers?
So the closest one to us is in Charlottesville, which is at UVA, and then VCU also has a kidney transplant program. Then there are a few other ones concentrated kind of in Northern Virginia, Richmond area, and I think there are 6 or 8 total, but there really isn't anything for Southwest Virginia.
Right. Is there anything west of Charlottesville?
No.
Okay.
Not in state.
Okay, yeah. So let's talk about, we're not going to get into what's defined or meeting the criteria in terms of the Certificate of Public Need at this time. But on the surface, the need, who has, kidney disease in this part of the state? What kind of numbers are we looking at, ballpark? And I'm talking about west of Charlottesville then.
Yeah, kidney disease and kidney failure is much higher in far southwest Virginia than it is anywhere else in the state. I believe it was Danville in 2022 that had the highest rates in the state. And, a lot of that has to do with social determinants of health. There's not great access to health care. There's also, high poverty in these areas. And so I think Dwayne Yancey actually wrote a story, it kind of looked at these numbers where there are about, 500,000 people in Southwest Virginia who would really benefit from having a kidney transplant program in Roanoke.
What did Carilion then cite as kind of proving its case for why it's needed in Roanoke? And you can get to whatever details you like on that Certificate of Public Need.
Yeah, so Carilion really focused in on the geographic distance to kidney transplant programs. So per a state health facility plan, there is technically a regulation in there that says every Virginian should be within a 2-hour drive to a kidney transplant program. And that they're only allowed to look at in-state programs. So that's what all of this is based off of, looking at in-state programs. And, there's a really a large area of Southwest Virginia that is like 5 hours from UVA, which is, the only one kind of in this region. And so with a kidney transplant program in Roanoke, that would cut people's drive time down by at least 2 hours. Right now, there's, I think, 92% of Virginians live within a 2-hour drive of a kidney transplant program, but with Carilion's program, that would bump that number up to 97%. So really, Carilion is leaning into this geographic distance argument as to why we need a program here. There's also, significant barriers to transportation that people in, even in Roanoke have a hard time getting over to Charlottesville for care.
So what opposition has Carilion run into? Who is speaking out against it? And tell me some of the reasons, the arguments.
Yeah, so it's really interesting. Carilion has had a lot of support from other health systems. VCU has talked in support of bringing this program to Roanoke. The only opposition has been from UVA. And it seems that this opposition letter is really what drove the recommendation for denial. And, they argue that having an additional program would not increase access to kidney transplants. So they say that geographic distance really has little to do with access. It's more about the number of kidneys that are available. I think that there are some arguments for and against that. During an informal fact-finding hearing that happened earlier this year, an expert from VCU spoke up in defense of Carilion's program. And, he said, there's a lot of viable kidneys that don't actually get used as transplants for a variety of reasons. Sometimes it's because it's too far, like the center that they need to send the organ to is too far away. Sometimes there isn't a surgeon available to harvest that kidney. There are a lot of reasons why a viable kidney might not actually be used for a transplant. So having another program might actually mean that there are, more opportunities to harvest viable kidneys.
So the state then was not going, said, well, no, that we don't find the need yet. Is it the state or who? Yeah. By the way, who runs the whole process of the certificate of public need? The thing you have to prove that there's a need for something before you can set something up medically.
Yeah. So the certificate of public need division is a state-run agency.
Okay.
And, like you said, they're responsible for, taking requests for new services to open in Virginia. The idea is to keep competing services kind of down so that there's no monopoly. And their argument is that it keeps prices for healthcare lower when you don't have, replicated services popping up around the community.
Do you know if that opposition came as a surprise to Carilion? Officially or unofficially? I'm just wondering.
I think it did. Carilion was really ready to start welcoming patients in October. And, they were all set up. They had everything in place. And I think that this opposition did come as a surprise. And I think it came as a surprise to Virginia residents as well. It's gotten a lot of support from the public. I think there were, 1,500 letters of support that came through as people began to learn that that it was recommended for denial. There were a lot of support letters that came through, and so I think it is surprising to residents of Southwest, and I think that they feel kind of overlooked. That oftentimes people feel that the profits of the health systems matter more than their access. So I feel like many are feeling sort of left behind yet again in Southwest Virginia. So,
wasn't there another reason cited for the denial or a concern about Carilion itself that you want to get into?
Yeah. So UVA cited Carilion's recent struggles with surgical sterilization for surgical tools.
And you reported on that for Cardinal News, was it a year ago, maybe April 2024, or something like that, March? And what was the finding there? What was that story about?
Yeah, so there was a complaint filed with the Centers of Medicare and Medicaid, CMS, and essentially saying that there were a lot of surgical instruments that were coming back from the operating rooms because they had blemishes on them. There were concerns over if those instruments were sterile. And so Carilion had to really address this issue. And so they went in and they got a whole new water filtration system. They revamped their sterilization process. And they, went through all of the steps that they had to go through with CMS in order to get that back on track and maintain their CMS certification so they could continue taking Medicaid patients. So that has all been resolved and signed off by CMS. UVA and the state COPN have argued that it is too soon to be introducing an organ transplant program after this issue with sterilization. The risk of infection is really high with organ transplants. And so that was one of their arguments as to why they recommended a denial for this project.
I wonder if that felt like a low blow to Carilion for that to be brought up.
Yeah, I think they did go through all the processes. They invested a lot of time and energy into addressing the issue. So now it's been resolved.
So getting back to geographic barriers that Carilion would argue there are, and that UVA is apparently arguing that's not even the point. It's the supply of kidneys, if you will, of healthy available kidneys. Currently, patients who are dealing with kidney issues in, Southwest Virginia and then the far Southwest region, are they going over to Tennessee? What's the closest? Do you know? I mean, is that what they've been doing? Because this problem hasn't just cropped up. They've been dealing with these health issues.
A lot of people go down to North Carolina.
Okay.
But through the COPN process, there is a regulatory rule where they can only consider programs that are in state, under the assumption that Virginia should probably be taking care of its own citizens. Also, there are sometimes challenges with Virginia Medicaid being accepted in other states. Other states don't always want to accept out-of-state Medicaid or Medicare, and that can get pretty complicated. I think a lot of people go to North Carolina for additional consultations. Oftentimes people are looking at, people who have the means to do so are looking at more than one kidney transplant program because it increases their likelihood of getting a kidney sooner. So if they're able to, they're going to multiple centers for evaluation.
Yeah. Did you meet anyone in as you were doing this story for Cardinal News and talk to a patient themselves who's right in the middle of this, who would very much be affected by the decision? And tell me their story.
Absolutely. I talked to a woman who is a Roanoke resident, and her name is Tanya Yvette Moss O'Neill. And she has been stage 4 renal failure for about 4 years. And, she lives in one house with 5 people. Her daughter and her daughter's children all live there. And her husband is has the only income for the family. Since Tanya has been on dialysis for so long, she's on disability because dialysis is really debilitating. You really can't have a full-time job while you're going through dialysis. She spends hours every day just sitting with a dialysis machine. And they're a low-income family. They have one car for the whole family, and it's not really suitable to drive on the highway. Yeah. she had been taking the train to Charlottesville to go to the UVA Kidney Transplant Center there. And she recently found out that she was denied from participating in their kidney transplant program at UVA for a couple of reasons, but one of those reasons was because she didn't have reliable transportation.
Yeah.
And talking to her primary care provider, he's confident that he can help her through these other health challenges that she has in order to be eligible for a kidney transplant. But the biggest barrier is going to be finding that transportation for her. You're also required to have a caregiver, and it takes a lot of time. Caregiver needs to drive you, to and from the center, and her husband has to work full time. So it's going to be a challenge for her to have a caregiver who's able to put that much time into driving her from here to there, to taking care of her after the procedure. And I think it's a real challenge for her because transportation feels impossible to overcome.
And that you mentioned earlier is a barrier that's very common.
Yeah.
The getting the transportation to the facility. Now, toward that end, I want to clear up something. When you are having and going through the process of preparing for a transplant and then you have it, are all the appointments at that location? So if she had been accepted, she would go to UVA repeatedly, or are there other locations because they know patients can't always go to UVA? Can you talk about that a little bit?
Yeah, so UVA has some outpatient clinics that provide some testing. They provide some evaluation for eligibility for the program. But from the patients that I have talked to, it sounds like oftentimes those appointments really need to be at the center in UVA. I know Tanya had gone to very few appointments at the outpatient clinic, and then when evaluating her eligibility became kind of more front and center, she was having to travel to UVA in Charlottesville. For blood tests and things like that. Another couple that I talked to who was at the informal fact-finding hearing in Richmond earlier this year, they, even after his surgery, for a couple months after his surgery, he was having to travel to Charlottesville for testing. And it was, no matter what, it's a lot of travel. UVA has really pointed to their outpatient clinics, but from the people that I've talked to, it doesn't sound like quite as much care can be performed at those clinics as you might hope to see.
So where are we? This podcast will be dropping right at the beginning of April. The Certificate of Public Need Division has said no initially. What happens next? Is that it? Or does Carilion get to make another case? What happens? Where are we in the process?
Yeah, so the record closed for this, this whole process on February 28th. So there will be no more, no more comments from the division. There won't be any more letters of support that can be submitted at this time. So the next step is for the state health commissioner to assess, materials provided by Carilion, materials provided by opposition, and, the thoughts of the division. So that will take, maybe 2 or 3 months. It's sort of unclear about exactly when a final decision will be made. We submitted a FOIA to get any final comments from the division.
Freedom of Information Act request. Just for people
yes.
that might not understand that.
Yes. And
what was it for? I'm sorry.
Any final comments from the Certificate of Public Need division.
Yep.
The division didn't provide any final comments. They don't provide an updated recommendation or anything like that. Occasionally they will take what they learned from the hearing and provide additional comments. This time they did not. A few more letters of support came through. But other than that, we didn't get a lot from the Freedom of Information Act request. But in the next few months, we'll hopefully see a decision from the state health commissioner.
Okay. If that decision is no, I'm just curious, does Carilion have to wait a while before they can ask for another one? How is there a, like you can't do it again for 2 years and then we have new numbers to look at? How does that work? Do you know?
I think that Carilion can appeal the decision and then, they would continue the fight. Beyond that, I'm not sure if there's a period of time, when they would have to wait.
Yeah. Okay. All right. So we'll see. And Emily Schabacker will be there to cover whatever happens next. Thank you so much for joining us on our podcast today, Emily.
Absolutely.
And if someone wants to get a hold of you, it could be this story, it could be any story, because you cover healthcare and there's plenty to cover there. How do they email you?
You can reach me at emily@cardinalnews.org.
Awesome. Thank you so much. And thank you for listening to the Cardinal News of Virginia, a podcast from Cardinal News. Thanks also to our sponsor, 5 Points Creative, to Cardinal News' Sherry Quinley and Zach Shelton for their support. Get more paywall-free news from us at cardinalnews.org. I'm Dutchie Jessee for Cardinal News.